A bunion deformity is when you see your big toe going and crowding against that second toe, when it's starting to bully over that second toe. You also see a big bump on the inside of your foot right next to your big toe. Sometimes that little bump on the side of the foot gets red, and so that can be really painful when you're wearing shoes. That's typically when patients come in. Since it's a bony deformity, there isn't very much that can be done conservatively except what you may have already tried, which is wider shoes, anti-inflammatories. Because it's a bony and structural deformity, you can't stretch out the tissues to keep your toe straight. It needs to be corrected if you want a straight toe, and it will also help prevent from getting other deformities in the other toes. The way that a bunion is typically corrected completely depends on the patient. It depends on how severe the deformity is, where the pain is, what your activity level is, what your recovery time, what you can afford for recovery time. It's going to really depend on also your health and your age. That will determine how we're going to treat this. And there's some that where you can just shave the bump off and you're back to work pretty soon, being maybe a few weeks, 3 or 4 weeks, but many times it requires moving that bone over to put in a corrected position to help straighten the toe. Sometimes you only have to take 1 week off. If it's a demanding job where you're on your feet, sometimes it can take up to 2 months. All of that does matter and will take part in what needs to be done to correct your deformity.